Hi, so what I've been asked to talk to you about today is about a research program that we're setting up here in Manchester. This is also in collaboration with Cambridge and UCL in London. So what we're trying to do is to identify women who are at high risk of breast cancer at a young age. So we already know that breast cancer is unfortunately the commonest cause of death in women aged 30 to 50 in most developed countries. What most women who develop breast cancer don't have is a family history. And it seems unusual for me to say it in that way, in a double negative, but it's really important that most women who develop breast cancer, it comes out of the blue. So how can we predict the risk for them? We well know about the risk factors like first full-term pregnancy. A late pregnancy increases the risk. We know that very early onset of periods, so under the age of 10, that increases the risk. We also know that family history, if it's there, we need to factor that in. But we also need to look at the density of the breasts and the genetics. And when it comes to genetics, we're not really talking about big gene mutations like BRCA1 and 2. We're talking about something called single nucleotide polymorphisms, or a polygenic risk score. And there's a separate video on that on the Prevent website for more information. So what we're trying to do is to identify women who are at increased risk. So what we're doing is taking a questionnaire for the risk factors. We are looking at a low-dose mammogram to assess breast density as safely as possible, and we're taking a saliva sample for the polygenic risk score. We will then be putting all of that together with some established, what we call algorithms, to define the risk, and then feeding that risk back to women in the community. Importantly, what we're also trying to do is to make this as inclusive as possible and try to encourage minority ethnic populations to come forward, because we know that these populations tend not to attend screening and risk prediction and prevention clinics as much as the white British population. So we hope to launch this project towards the end of 2021, and this will take approximately 3 years to complete. And at the end of that, what we hope is that we will establish whether we have an acceptable approach to risk prediction in young women that would lead to more prevention and early detection to reduce this terrible burden in the young population. Thank you.